My name is Dr. Christopher Rodriguez, and I'm the director of the District of Columbia's Homeland Security and Emergency Management Agency. I'd like to begin by thanking our host today for having us here, and I want to begin by starting and talking to you about the District of Columbia's operational posture in the midst of COVID-19, as well as the issue of food security here in the district. First, we want district residents to know that we will continue to deliver essential services and keep our systems and services operating throughout this event. And for anyone who'd like to review the status of our agencies and our posture, please visit coronavirus.dc.gov/newsroom. I'd like to also begin by talking a little bit about the commercial food supply and what we're seeing here in the district with regard to grocery stores and convenience stores. Right now, what we are seeing is a lot of what we would call hoarding and panic buying. And what we're seeing that as a result of that is that a lot of shelves are empty. And we understand that this is a unique and unprecedented event, and at times that can evoke fear in people. And in many ways, hoarding is a natural reaction to the uncertainty of our current situation. We want district residents and the public to know that this government, the mayor, is in regular communication with industry partners, our grocery stores, and our suppliers. And in that communication, we are working to understand and to help them through any issues that they might be facing. It's important to note that what you're seeing in stores isn't actually a lack of supply. It's the increased demand as a result of hoarding and panic buying. And our message to residents is simply this: do your part and resist the temptation to buy more than what you need. So what we're saying is buy what you need. And if residents follow this guidance, suppliers will be in better position to restock shelves. If the panic buying and the hoarding continues, we will also continue to stress that supply chain that we're talking about. And let me state this as clearly as possible. Grocery stores will remain open throughout the duration of this event. People do not need to panic about not being able to buy toilet paper or paper towels. We need to do our part, and we need to make sure that we buy what we need. It's our responsibility to this community and to our fellow residents here in the District of Columbia. The other important piece of information that I'd like to share with you today is Mayor Bowser's tireless efforts to make sure that our most vulnerable residents have food security and are getting the food that they need. The District of Columbia has made a commitment to provide meals to all students, and that began today. And we're happy to report from DCPS that we experienced no major issues at any of the sites, that students got their meals, and that anyone who wants to view where those sites are, again, can go to dcps.dc.gov/coronavirus. Similarly, District of Columbia government is providing meals to seniors at over 46 meal sites throughout the district. And interested seniors should contact the Department on Aging and Community Living at 202-724-5626 to learn more. In addition to our feeding operations, we're working with other food aid organizations, such as the Capital Area Food Bank, DC Central Kitchen, and many other outstanding service organizations to better understand the demands on their systems and the support district government can provide to them. Finally, our Department of Human Services is working with the Community Partnership and other partners to increase meal capacity at short-term family housing, low barrier shelters, youth drop-in centers, and other transitional housing sites. Before I turn to Mayor Bowser, I just want to reiterate once again, grocery stores will remain open throughout the duration of this event. We understand that this is an unprecedented incident that many of us have ever faced. But we encourage district residents to do their part, to buy what they need, and in doing so, help their fellow residents. With that, I'll turn it over to Mayor Bowser.
Good afternoon, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. As Director Rodriguez said, we're here at Food and Friends to share information with the community about how everyone can help us flatten the curve. You know from being here with us many times and at many volunteer events, Food and Friends delivers meals and groceries to members of our community who depend on their services, including seniors and residents who are at risk because of illness. In these unprecedented times, and as we continue to mitigate the spread of COVID-19, they are an example of how we all have a role to play. We wanted to highlight all of the ways that we are keeping D.C. residents with more food security during these unprecedented times. And Food and Friends and nonprofits like Food and Friends who are continuing their missions of serving seniors and those who are living with illness is a very, very important aspect of our food security system. I also want to thank everyone for practicing social distancing. There is, of course, a lot more that we have to learn about COVID-19, but one thing that we know is that social distancing can mitigate the spread of the virus. At the moment, social distancing is our main tool for flattening the curve. So we continue to advise you to stay away from congregate settings, avoid large crowds and gatherings, and if you have to go out, and you're keeping 6 feet of space between you and other people. In short, social distancing means you're staying at home as much as possible. To that end, tonight, beginning at 10 p.m., we have issued an updated guidance. We are making all bars and restaurants in Washington, D.C. grab and go, carry out, pick up, whatever you call it, only. Those establishments may also deliver food. You may not dine in or visit the bars at those establishments. We are only allowing carry out, grab and go, pick up, or delivery at DC bars, restaurants, and taverns. So let me be very clear about why social distancing is so important. When we slow the spread of COVID, we protect our hospital and healthcare facilities from getting overwhelmed. We are able to keep more hospital beds open and make better use of limited resources. So that means when people are seriously ill, they will have capacity in our medical system to be able to be treated. We also want to amplify the messages that we've heard nationally that you just heard from Chris. Our own Emergency Operations Center has been stood up for the last several days. And part of the work that they do is ensure all of the supplies, not only for the operation of DC government, but help track supplies that our private retailers will be taking advantage of. We are assured that there is supply in the system, and we want everybody to recognize that they can pace their buying for their own individual family needs. When we say we all have to do our part, that's part of our part. Don't overbuy. To make sure that there is supply for others who need it. So we continue to ask you to pay attention to that. We're also concerned because as people social distance, there may be people who we don't know who have needs. So check out to the seniors in your life, check out to senior neighbors, text friends, and let them know about all of the information that they can access at coronavirus.dc.gov. And so with that, I want to ask Carrie Stolfus, who is with Food and Friends, to come up to tell you about their operations.
Good afternoon. I'm Carrie Stoltzfus, the Executive Director at Food and Friends. Thank you all for being here today, and thank you to Mayor Bowser for her leadership in this difficult and unprecedented time. The mayor and her team have been strong partners to Food and Friends, and we share her commitment to ensuring that everyone in our community stays as safe as possible, and has the resources they need. Food and Friends was founded during the AIDS epidemic, and we met that crisis head on, so we know how to face down a challenge. We're in a different crisis today, but everyone should know that Food and Friends is still here, and we're still ready. We continue to provide meals to our 1,600 clients facing serious illnesses such as cancer and heart failure, who are among the most vulnerable in our city and our region. These are the people who need to stay home to stay safe. We practice excellent food safety and hygiene standards every day, and based on the recommendations of the Mayor's Office and DC Health, we're taking additional steps to mitigate risk and enable us to continue to do this work. Until this crisis is over, we'll practice no-touch deliveries, greater social distancing in our kitchen, and we're preparing for additional deliveries of shelf-stable items to our clients. We're doing everything in our power to maintain care for our most vulnerable neighbors, and we need your help. Online donations are the best and fastest way to help and can be made through our website, foodandfriends.org. We are also in serious need of volunteers, but we do have restrictions on who can volunteer in order to keep our safety standards high. If you're interested in volunteering, please contact us at our website to learn more. Thank you again to Mayor Bowser, Dr. LaQuanda Nesbitt, and everyone in DC who's working tirelessly alongside of us to serve our community. Thank you.
Okay, we will take your questions. Yes, Mark.
Mayor Bowser, does the closure extend to movie theaters or any other venues other than restaurants and bars?
It does, and I'm going to ask Dr. Nesbitt to come up and talk about the updated DOH guidance, which I included in a new mayor's order.
Good afternoon, everyone. So, as Mayor Bowser has mentioned, we have a new mayor's order that addresses additional closures. So, in addition to the bars and restaurants and taverns having the restrictions on seating and in-house dining, we have added additional facilities to include health clubs or gyms, health spas, massage establishments, and theaters to the closures that become effective tonight at 10 p.m.
So, what changed overnight? Because yesterday we were at restrictions for restaurants and we only had one new case. So what prompted you to take the further step?
To clarify, our restrictions for restaurants and nightclubs went into effect on Friday, and we provided a clarification for their operations yesterday. Some of the things that have gone into effect is being consistent with the CDC recommendations or guidance that went into effect or were provided to us last night in terms of things that they are asking communities across the country that have evidence of community transmission to do. And we want to be as responsive of a community as we can in the U.S. to help be on the forefront of flattening the curve and being responsive to helping to end this pandemic in the U.S.
Shops and salons, since there's close contact there. My barber's in the 70s and I'm trying to stay away.
So we have done a very close assessment of the personal care services industry, and our guidance, as we have updated it, takes into consideration those types of establishments that tend to have a high number of occupants in the establishment at a time, where the ability to put in social distancing measures is very limited. We have looked at the other personal care services industry where those vendors or those small business owners are able to implement hygiene practices and other scheduling practices that can limit the number of patrons that are in their businesses at a particular time. And we have evidence that that is happening in the district.
Consider the risk of community transmission at a moderate level in D.C., or are we at a high level now?
We classify ourselves as being in minimal to moderate. We are unable, because of our porous borders, to only look at the data for the district. We have to take into consideration what is happening in the National Capital Region, because we know that some of the cases in Maryland and Virginia have had exposures in the district, or that the district cases have led to other cases in Maryland and Virginia. And so we have to look at a holistic picture for the National Capital Region.
Is the city in a position at all to help some of these restaurants and food service workers financially at all? Because I know a lot of people are essentially suffering right now.
So we have been working with the members of the council who have circulated a draft piece of emergency legislation that the council will consider tomorrow. There are a number of pieces of relief we think that will help in these very difficult, uncertain economic times. They include how do we implement broadening eligibility for unemployment, for example. So people who have been separated, laid off, or have reduced hours will be able to qualify for unemployment. We're also obviously very concerned about an industry that really helps drive the economy in the district, and that's our hospitality industry, to include hotels and restaurants, but also the people who support them, the workers, the caterers, and all of the ancillary services that go into events, many of which have been canceled and will be for the next many weeks. So those are all very important. So that the council has circulated that draft. We'll vote on it tomorrow, and I will sign it as soon as it hits my desk. Yes.
How this applies to independent contractors, drivers, gig workers, that sort of thing. And I didn't get a clear answer, and then someone told me that the city has to work with on the federal side to try to get some sort of action on that end. Is that true? Can the city do anything to help independent contractors? Or
we continue to look at what we will be allowed to do with the revised unemployment guidelines. So that's going to be important. We are also seeking authority, and it's in the draft that the council has circulated, to look at what we can do specifically for small and local business owners or business owners in the district. We will have to develop that program and figure out how to implement it and get dollars out the door. It's going to be obviously very important that we make it on the other side, and already we are starting to develop ideas around what a recovery effort for our city will look like. Yes, Sam.
We talked to a homeless man who had a test taken, and he said that he was told to self-isolate as he awaited the results, but he doesn't know where he can self-isolate since he is a homeless person. What provisions does the city have for that?
He needs to talk to us, and we will coordinate with his service provider. So whoever his doctor was who made that recommendation. I was in a meeting earlier where we heard about a case that sounds like this one, and our Department of Human Services is coordinating with DOH.
So they should report to...
Did you talk to this person?
I talked to the person at a place called Amazing Love. I think it's a health clinic.
Okay, so we're going to it sounds like the same set of facts I heard a bit earlier, so we'll track him down, and DOH will make the appropriate referrals.
But in a case where, again, a homeless person, he said he slept at the shelter last night because he didn't know where else to sleep. They shouldn't be doing that, right?
Well, I don't want to talk about a case that I don't know all of the facts about, but this is what happens. If we have a person who's experiencing homelessness that needs to quarantine, we will make sure that happens.
And they can get this to happen through?
DHS. In our shelter hotline, that anybody at that hotline or 311 can make the appropriate referrals. Yes. Mark, you didn't get a chance.
Mayor Bowser, if somebody files for unemployment insurance and they're a tipped employee, do you know, is that based on their what they would get? Is that based on their hourly wage, or is that based on their reported income?
Let me ask the city administrator if he can respond. I may have to have the DOES director give you that answer, Mark. I don't know. I don't know standing here.
Thank you, Mayor. So we're reviewing the DOL guidance on that issue. There is a process where wage verification takes place for a claimant. We can either limit or waive that. And so we've been talking to DOL. Our Department of Employment Services has been talking to the Department of Labor all weekend to try to clarify circumstances like that. So is it based on wage evidence, or is it going to be a self-certification, which would include those tips? So we hope to have that final guidance even as the council considers this legislative measure tomorrow.
Yes. Just on the issue of testing, obviously a lot of jurisdictions have expressed concerns about the availability of testing. Is the district doing anything independently to make sure that it can ramp up its capacity and offer kind of people this idea of like drive-through testing or kind of multiple sites?
We made a request, you may have seen, to the president. And when I say we, I mean Washington, D.C., myself, and the two governors from Maryland and Virginia, to ask the federal government to provide federally supported testing sites in the National Capital Region in D.C., Maryland, Northern Virginia. I had the opportunity to ask the president about it directly today in a call that I participated in for the nation's governors. And we expect to get a response from them in doing that. And as I understand it, the support would come in the form largely of technical assistance, a website they've designed, call center support, and some logistical planning. And we will now consider how we could support that if we're selected as one of the jurisdictions. Yes.
What are the rules of what power do you have to enforce the rules? I heard, for example, somebody said that one restaurant said they were not going to close that.
Sure.
What happens in that?
Well, we have the power in a public health emergency or a state of the emergency, which we are under in the district, to revoke business licenses. And so we would identify the ways in which a business did not comply with a DOH mandate or other mandates that may be issued during the emergency. And once we establish that they have defied those orders, we can revoke their license.
You said bars and restaurants. Isn't it the case that in a bar you're not allowed to take drinks with you? I mean, you have to buy liquor at a liquor store or something like that. Is that not the case?
There, in the legislation that we are moving to the council, a restaurant, I think, may deliver closed containers with their food order.
So they
Is that right? I got that right? Okay.
So you wouldn't order a mixed drink, but you could order a beer or something like that?
Or probably a bottle of wine, I think, is where we're going with it.
Can you clarify that? Will restaurants be able to deliver alcohol?
Closed containers, if the emergency, if that makes it, that is a provision that's circulating in the draft emergency legislation. Yes.
Can we talk more about the preparations that hospitals are making for surge capacity? There was the talk of Providence Hospital coming back online, but Providence doesn't seem interested. Like, are there other unused facilities that are being looked at?
Yes.
Can you expand?
And I don't know what you mean by Providence not being interested. Well, we are looking for excess capacity that any of the hospitals can tap into. And we are also going to tap into the kind of logistical planning abilities of the National Guard to help us in that regard if we have really have the need for mass facilities. And 17.
Health lab increase. Last we heard from Jennifer Smith, there was a holdup with getting robotic equipment for extraction.
I don't think it's a holdup, but we're expecting the equipment this week.
And has there been been any penalties for anyone violating mass gatherings or any of the other restrictions that have been gone into effect?
No.
And how is the city enforcing these measures?
Right now, we're taking complaints from residents, and quite frankly, and I'm glad you've mentioned it, because we can talk about enforcement, and I can pull our limited resources to chase people down and give them fines, or people can do the right thing. Businesses can do the right thing. And that's what we're calling on everybody to do during these unprecedented times. Listen, as mayor, I don't wake up in the morning and try to figure out how I can shut down a business or issue a fine, but I will do it. Yes.
Appreciate riding my bike down to the Wilson Building. Construction, active as usual, and those are sites that could potentially have hundreds of workers at them. How does this mayoral order apply to construction? Would you ever take the step of stopping construction temporarily?
We continue to look at that, Martin. The construction sites are outside generally, so they're not in confined spaces. We would ask that any work being done outside also adhere to our guidance for people to stay 6 feet apart from each other. But right now, we have not pulled any construction permits.
Mayor Bowser, you mentioned the National Guard a minute ago helping out. Is there any movement on you activating, putting on standby the National Guard?
Yes, as of today.
As of today, what?
As of today, we are standing them up. They've reported to the EOC, and we will continue to think about ways that they can help, particularly if the federal government works with us on testing sites in the National Capital Region. We think we would need to be able to tap into their assistance to stand that up.
So,
we're in talks with the Secretary of the Army, who helps coordinate that. Yes.
One last thing. I mean, housing prices were already tough on people before this. Now there's concerns about people who lose their jobs and so on and so forth. Some people are calling for rent freezes and that sort of stuff. I mean, what do you think about housing moving forward and what you could do to address people not getting booted out of their houses at some point?
Well, obviously, it's a cascade, isn't it? So what the emergency legislation addresses is during the emergency that there are no evictions. I think the courts have also stood down those types of eviction activities at the Superior Court. So we know that is going to happen. But there will be people with rent issues, mortgage issues, and the like. And so how wages are replaced will be very important in that discussion. Thank you, everybody. Yep, okay.
There was talk of a DC case linked to 10 other cases in the region. Was that the Christchurch rector, or is that another one?
I'm not. Do you know what he's referred to?
Yes, we had multiple cases in the region associated with the initial case at Christchurch. The number continues to increase.
So let me finally say, you heard Director Rodriguez mention earlier that our government is in a modified operation status. About 55% of our workers are working remotely. We've updated our website with how those changed operations affect basic government service, and that means that there are still many thousands of DC workers who are reporting who are performing essential face-to-face services. So I want to thank our Department of Public Works, who's picking up trash on schedule today. I want to thank our Department of Corrections, who are making sure that our residents are safe at the DOC. I want to thank the Metropolitan Police Department. I want to thank our good people at the Department of Health. the Department of Homeland Security Emergency Management. I want to thank all of my staff at the EOM and the city administrator staff who are manning our EOC and making sure that all of these questions can be answered. And I want to thank all of you for being here to help get the word out to residents that while we're in unprecedented times, your government is well prepared. We're planning, we're engaging, and we're executing. And we will get on the other end of this and focus on our recovery so that our city, our thriving city, will be able to help people who will suffer during these times. Thank you.